Thank you very much for joining us today, and thank you to the SALT community for allowing us to present this information. I'm Nicholas Vita. I'm one of the co-founders and the CEO of Columbia Care, which is one of the largest medical marijuana companies in the United States, and we are actually one of the largest globally. Some of you may have never heard of us, but you will, and you're about to find out why. So I'm going to start this conversation with a story. And back during the Napoleonic Wars, Napoleon used to take his prisoners of war and put them in single locations. And he used to go to those locations to meet the prisoners of war, to learn a little bit about the people who he considered adversaries. And one day he came across a gentleman and he said, "How old are you?" And the response was, "I don't know." And Napoleon said, "How is that possible? How can you not know how old you are?" And he responded by saying, "I keep track of a lot of things. I keep track of my family, my possessions, but I don't keep track of the years, because the years are not something that can be taken. They just happen." And I always thought about that anecdote as a sort of an old example of somebody who has an eternally optimistic view and it calls themselves 35 or 39 years old forever. But the reality is, I actually disagree with the sentiment. I think time can be stolen. I think years can be taken. And the basis of that, and I think one of the most egregious examples of that, is what's going on right now with the opioid crisis. Just to put it in perspective, 50,000 people, or about 50,000 people, died last year of opioid overdoses. Over 1 million people will die by 2020. If you think about the annual run rate just for a moment to get some perspective, that's about 235 Dreamliners just falling from the sky, everybody on board dying. Can you imagine any other industry, any other circumstance where that level of imperfection and performance doesn't result in a catastrophic outcome to the manufacturers, to the distributors, to the providers of those services? Something like that would literally kill the major manufacturer for the plane and the travel industry at large. They would literally have to resurrect the Titanic to get people to go across the ocean. Now, if you think about the way these drugs are handled in today's society, you've got one child every 25 minutes being born with an opioid addiction issue. And think about the implications that has for the future of the country, right? It's staggering. Now, the irony here is that the standard of care is still opioids for pain management, even in pediatric settings. So you've got children who are being exposed to these products, you've got adults who are being exposed to these products, and they're developing these habits, and really not much is happening to offset that tail risk that is having such a profound effect on the economy and on our communities. And that's true unless we all do something. And I say we all because this is a room full of influencers, right? SALT is a community of financial investors and sponsors, and they have access to leaders in all forms of industry and policy. And part of this is a call to action. But just out of curiosity, a show of hands, how many people here know somebody who's been affected by the opioid crisis? It's most of the room. I have. For those of you who haven't, consider yourselves incredibly lucky, because 1 out of 3 Americans actually would have raised their hand. So we understand what's happening. And I think it's worth spending a minute just understanding why it's happening. You think about what the federal government is doing. A couple of weeks ago, there was an initiative launched to commit $350 million to making sure first responders have access to Narcan, which is a drug used when someone is actually overdosing, to sponsor things like Tai Chi to help people find a meditative way out of their addiction. Just this morning, Senator Warren proposed a $100 billion initiative to be part of the CARE Act to fight opioids. The problem is that this is not a money issue. This is actually a completely different set of issues from what we're seeing on the ground in all of our markets. And we're across the country, so we see a lot of what's happening on the ground. What we need is a plan of action and something that is tangible, that you can actually provide a better option through data. Because there's too much rhetoric, there's too much politics, there's too many things that people are jumping to conclusions without real validation. And if you don't have validation and data, the scientific community, the policy community, the people who really need to make these decisions will never listen. Because ultimately, data trumps opinion. And that's exactly why there are 58 opioid prescriptions written per every 100 Americans last year. there are no alternatives. You know, we could talk about the industry itself, we can talk about the conflicts of interests within the manufacturing community, the distributors, we can talk about the regulatory structures that are in place that make it very difficult to provide and develop alternatives. But ultimately, people still have pain. They need something to alleviate their symptoms. And that's why I'm here, because we think, and we're sure, actually, based on the data, that we've found a solution. And that solution is in the form of medical cannabis-based products. So just to give a little bit of background here about who I am, for those of you who know me, I actually spent a lot of time in financial services before I moved into an operating role. I worked at Goldman Sachs for many years until the IPO, left and joined the buy side. So I actually sat out here in the audience for a long time. And the irony is not lost on me that it had to be cannabis that actually put me in a position where I'm actually speaking to the entire community of SALT. Because that's, you know, when you're at Goldman, when you're on the buy side, you just don't think about how funny the world's twists and turns are. But what we've discovered is that when we were building the business, it was so fragmented, there was really no leadership, no thought leadership, no data leadership, nothing to really validate the use case for the products. So we began collecting data. And what we did is we created Columbia Care. And Columbia Care has two attributes that are very, very unique in the space. One, we have a provider-based access model, so we use pharmacists as the primary conduit to provide that educational experience and access point for patients and their doctors. And this is relevant for consumers too. So it actually has a very broad-based appeal because most people who come in at this point are baby boomers and women. The demographics have changed dramatically from 5 years ago. So we don't use bud tenders because the conventional model in our industry is focused on the product, whereas we focus on the patient. What that allows us to do is to integrate our innovation piece and our manufacturing piece directly into the needs of the consumers. And that's a very unique attribute, especially in healthcare, where you have so many layers of bureaucracy and distribution channel in order to get to the ultimate user. We know who uses our products, why they use our products. We know what's in those products. We can actually link the API to the use case. And we have over 1 million interactions that allow us to sort of look at this on a population scale. So the question of whether or not medical marijuana or products like these work, I think that's been answered. Because the National Academy of Science came out and actually validated this in terms of sleep, anxiety, some forms of nausea, some forms of pain. But the question of whether or not it can actually solve the opioid crisis is something very different. And I'm here to tell you today, and this is really one of the first times we've really discussed this, we have the data to show that it works. And what's fascinating is that there was a pilot study that was run over a 9-month period with no specific outcome, no objective. It was just to see what happened when we provided our products and their highly formulated cannabinoid-based medicines. So they're hard-pressed tablets. They're in the form of normal medications, and they're measured out in milligrams. So the data is actually comparable. And 62% of the people who were given access to our products showed a reduction or stabilization in their use of opioids over a 9-month period. That is one of the most staggering statistics in sort of this field of research anyone has ever seen. So much so that when we engaged with the New York Psychiatric Institute at Columbia University, they were so shocked that they actually went to the federal government and they asked the federal government for a grant. They went to the NIH. Now think about the irony here. One of the leading research institutions on the planet is going to the federal government to ask for money to research a product that's actually technically illegal, right? Now here's where it gets really interesting. NIDA, the National Institute of Drug Abuse, which is a sister organization to the DEA, actually awarded an R21 grant to Columbia to perform further analysis, to validate these findings. And the reason why they were able to do it is twofold. One, we had the data infrastructure, we had the connectivity with the patients, and we were able to bridge the two. Two, we know exactly what's in the product every single time. That consistency of quality, exactly what you get in a pharmaceutical setting was there for the first time ever. So it's not about a plant versus a pill. It's actually about a milligram of active ingredient versus a milligram of active ingredient. And that comparative set was profoundly, profoundly important, we believe, in causing a federal agency effectively to break its own rules and make sure that this funding was made available to perform this analysis. So when we think about it, we've got this study that's out there that could be the end of the story, right? We now know that this works. We now know it works in a specific use case. We now know what works, how it works, and why it works. And our view is that this is actually the moment when we wanted to lean in. And we do that, we made that decision because of the magnitude of the problem. We wanted to go out to the community of researchers and actually align ourselves with institutions nationally to perform what we think is a very important civic service that has a profound economic impact. Ultimately, if we collected the data, we could change the opinions of payers, we could change the opinions of providers, and we could make a huge impact on the lives of individuals. So, by offering an alternative, not a joint, not an edible, not something that you think about when you think about recreational use, by offering a real medicine that is precisely manufactured and dose metered, you can actually solve that problem, and that's what we've done. So as we think about where we are today, we had to figure out a way to actually create that structure and that partnership that allowed us to increase the N of the study, to really go out and not only stop that first use event to monitor patient performance, but also provide existing opioid-using patients with an alternative. And so what we've done is we've added another research partner. We're now partnered with Montefiore and the Albert Einstein College of Medicine, and we're launching in New York an initiative, and we're calling this initiative 100 Million Ways to Break the Opioid Crisis. And the reason for that is that our intent is that we want to take 100 million doses of opioids off the streets. We want to replace it with medical cannabis. We want to prove the economic impact. We want to prove the efficacy. And we want to take what now the FDA is terming real-world data, which is patient-reported outcomes data, which we have a larger database than anyone to draw from. And we want to turn that into something very productive to change the standard of care. Now here's just sort of some, we always talked about edge when I was on the buy side, and here's some edge. Over 11 million doses of our products have already been administered in New York State alone. You know what kind of feedback we've gotten? There are no adverse events. I can count them on two hands. And it includes euphoria, increased appetite, people sleep well, right? Think about that. So on one hand, you have a standard of care where people have cardiac arrest and they literally die, or they can become addicts. 80% of addicts actually start off as prescription opioid users. On the other hand, you have an option that is proven to work, where the worst thing that happens is you eat too much pizza, you sleep well, or you laugh a lot. How can that possibly not be something that we can all rally around? It's so common sense based. And so knowing that that's out there, knowing that that experience has already been validated, we can't lose. This is a fight we are going to win, and we're going to win in a landslide, because it's irrefutable, right? The numbers speak for themselves. Internally, we call these types of projects BHAGs, big, hairy, audacious goals, because everyone tells us you can't do something. Everyone tells us it's impossible to do it. We'll never get the type of adoption that we're looking for. Well, I heard the same thing about building the company, and we're one of the largest in the United States and the world now. Every time we try to do something, everyone says what can't be done, but this is about what can be done. So with Montefiore and the Institutional Review Board, we get the credibility to take the analysis and take ourselves out of the process, but leverage our infrastructure nationally to make sure that patients can come into our facilities, have an experience with a pharmacist, swap a prescription for an opioid in return for an equivalent amount of our medication, and then enroll in a program. And the way we're doing this is we're taking away the financial incentives that patients have to use poison. Right? The insurance companies have done our communities a massive disservice because they're actually paying and subsidizing the use of opioids. They won't talk to us, but they will. And that's where it becomes really interesting. So with the removal of 100,000 or 100 million doses of opioids, and we think that'll probably impact about 50,000 people, that's going to be enough data to go back to the policymakers, to go back to the payers, to go back to the providers, and really change the way we think about the standard of care. And it represents what we consider a revolution in pain management. Now, I'm sure a lot of you are thinking, this is wonderful, this is great. Why is it really relevant to me? And this is where the scope and the magnitude of the problem really becomes important. So a member of my family worked for an extremely large private equity firm. They bought a company, they did financial due diligence, they went through the whole thing, and he was one of the team members they sent down to actually begin to institutionalize some of the operational efficiencies that they thought would improve performance of the company. What they found is that the entire labor force was plagued by an opioid addiction issue. They were calling them workers' comp issues, but it wasn't workers' comp. They're not being injured on a job. They're literally addicted to drugs. They're addicted to opioids. It impacted efficiency. It impacted the prospects of the business. It impacted the ability to execute on the strategy. It's prolific. And when he went around and talked to other management teams at other companies in the industry, they were all dealing with the same thing. So there's actually a fiduciary obligation, if you're owning these companies, to go through the process and make sure that you're engaging with management teams, with board of directors, to let them know that this is out there and to really force the matter at hand so that these companies can perform and our communities can actually succeed and thrive. So where we are today, we have an option. We know that this is in our own best interest. We know this is in our best interest of our industry. We know that this is in the best interest of our companies. We know that this is something that has very little, if any, downside. And so it's one of the few times when I can honestly say that the nexus between impact investing, meaningful, purposeful investing strategies, civic duty, and economic return go hand in hand. Every single one of those gets touched by this because part of the analysis we're going to be going through is the benefit economically on the companies, on the individuals, on the communities that we're looking at. Because I can tell you the staggering cost of dealing with a population where you have these spikes in actuarial costs relating to the hospitalization, treatment, and overdose issues associated with opioids is a drag on the entire economy at large. So what I'm here to do is I'm asking you all to join us on this journey to break the back of the opioid crisis, to advocate on behalf of common sense, to advocate on behalf of what it is we have proven to be successful. It's at your fingertips, okay? And it starts with a very small group of thought leaders, but this is exactly when leaders matter. This is when the private sector can do what the government can't, because we can be faster, we can be smarter, we can be more aggressive, and we can push agendas. And that's why we're here today at SALT. So when you think about a $30 billion economic drag or opportunity, that catches people's headlines. But when you think about the ability to actually profoundly impact the integrity of the communities that we all live in, that we all invest in, that is mission critical too. So thank you so much. I really appreciate your time. It's a pleasure to meet you. Thank you.
Today, 1 out of every 3 people living in the U.S. knows somebody addicted to prescription opioids.
My brother.
My sister.
My mother.
My father.
My husband.
My best friend.
Someone I've known forever.
The person I love the most.
The person I love the most.
The person I love the most.
It's no wonder opioid dependence feels like an epidemic. Given the choice between living with chronic pain or taking dangerously addictive opioids, most of us take our chances. But in the U.S., almost 50,000 people fatally overdose on opioids every year. That's 130 people dying every day. The cure has become the disease. A better option has been hiding in plain sight. Cannabis has sparked a revolution in medicinal pain management, and Columbia Care is leading the charge in data-driven cannabinoid research. Our precise, dose-controlled, pharmaceutical-quality medical cannabis has reduced opioid use in 62% of neuropathy patients. The science is groundbreaking. The implications are game-changing. You don't have to choose between opioids and pain. We found hope in a better option. One dose at a time, Columbia Care will prove that regulated and consistent medical cannabis poses the greatest threat to the opioid prescription machine. Through an unprecedented research partnership with Montefiore Hospital in New York, eligible patients can register to access Columbia Care's pharmaceutical-quality medical cannabis as an alternative to opioids. We'll start with 50,000 patients in New York, but we don't want to stop there. We want to build on this research to drive radical change with doctors, insurers, and policymakers. Ultimately, we aim to replace 120,000 opioid prescriptions with medical cannabis and take 100 million doses of opioids off the streets. We're asking for your support to expand the reach of this study, because every dose we contribute and every success story we uncover can help us go back to the prescription pad and rewrite the options for pain management forever. Join Columbia Care in the movement to take 100 million doses of opioids out of circulation and set a new standard of care for chronic pain. Help us break the opioid epidemic once and for all.
Thank you.